Can a car company really revolutionize medical care? Well, it turns out that it can. Virginia Mason's clinic in Kirkland, Washington is applying something called the Toyota Production System to the medical industry. It's a model that focuses on improving efficiency and reducing waste. When applied to a primary care clinic, it totally transforms the business of making people healthy.
Hi.
Hi.
The way the patients check in.
I'm here to see Dr. Pittenger.
The way the clinic's laid out, how supplies are handled, how records are kept, and new state-of-the-art software. They've all made the system more efficient. It's a well-oiled machine with the ultimate goal of increasing safety and providing better outcomes for patients. Please welcome Dr. Kim Pittenger, the medical director at the Virginia Mason Clinic in Kirkland, Washington. Kim, welcome to Health Tech Today. Now, in the spirit of full disclosure, I started my career at Virginia Mason, practiced there for about 10 years. Tell me a little bit about, I know a lot's gone on since I practiced there. Tell me a little bit about this Virginia Mason production method and what it's modeled after.
Well, it's modeled after the Toyota production system because Toyota learned over time that assembling cars is fraught with mistakes, and that it does no good to build a defective car that you have to repair before you can ship it. So they worked with their engineers and their teams of workers and figured out ways to make mechanical devices that mistake-proof the assembly, and they built their whole assembly process on a platform of what's called mistake-proofing. And then they standardized work so that you were less prone to making errors, and everyone accepted this standardization because it actually sped up their work. And over time they found that the more they worked on reducing the wasted time, the better the product was. The more they worked on quality, that's when the dollars fell into place. Rather than our usual approach is, show me the money, and then we'll work on quality.
So now a lot of people would say, well, but car companies and manufacturing, that's not healthcare, and yet you've made it work.
Everybody's producing something. We're trying to produce a perfect patient experience, actionable knowledge out of angst and unusable information they might have gotten from a website or a family member or their past experience. Everybody's producing something. So what we do is take the concepts from that production system and systematize what we do. We have standardized sequences in which we do our work, and we operate on a platform of mistake proofing, which allows us to avoid mistakes in the first place. If we're not paying for our mistakes all day long while we deliver medical care, we're able to save $1. We can bill $1 all day long. We generally get paid 46 cents in a fee-for-service arrangement. So we'd rather save $1, make care safer, and have patients want to come back because it's a good experience.
So let's talk about that perfect patient experience. Take me through what a patient sees and does as they enter the doors of your clinic.
Well, when they come off the elevator, it's not like the usual place. They see a mural that depicts the past into the current of Virginia Mason visually. And then there are a series of desks that are not like usual reception desks. And at that desk, they simply confirm their identity, and they get a placard that shows the region of the building they're going to. Patients don't understand north, south, east, and west once they're inside, so we name them for biomes: mountain, meadow, forest, beach. And they get a room assigned, and affixed to that placard, which is a very nice laminated photo, they get an RFID device, which now tells us their location. What we added to that system, called the Versus system, was the tracking of time, so we can track how long we make them wait. Our whole goal is to reduce waits because they're waste, and they don't make anybody happier or healthier.
So this is a little RFID chip in the badge that kind of follows them on their journey through your clinic.
Everyone in the clinic who works there is wearing a transmitter, including the EKG machine. You must know where it is at all times. And the transmitters in the ceiling are mapping it out through software that appears on our monitors while we work.
And also, there's sort of a graphical interface that you use, which actually maps, if you will, the movement of everything in your clinic.
Yes.
Well, let's take a look at that and tell me a little bit what you're seeing.
Well, there's the floor plan map of the clinic, and you can see that green rooms are ready to use. Yellow rooms are not ready to use. There's either someone in there or it's almost got someone in it. And the black rooms are dirty and need cleaning. You can also see the little figures moving around. The stethoscope moving around is a provider. You can see the little purple patient, and you can also see the medical assistants in blue. And you can also see in the laboratory there's an icon for the EKG machine, like I mentioned. So you can find somebody you need to talk to by looking at the map and just walk over there and talk.
So many primary care clinics today are really struggling. The overhead is horrendous. You know, the doctors will say, if I can just get more time with my patients, or if I can get more throughput, or frankly, if I could just get more time to go home at the end of the day without all the hassles. What I'm hearing from your doctors is really almost a joy of patient practice again.
Well, all the time we don't spend face-to-face with patients is potentially wasted time. We divide care into two kinds of care: direct care, you and me face-to-face; indirect care, the care of the information about your recent visits, things we've agreed about that we're going to do in the future, and I don't even see you, we just exchange information. And that indirect care is, we think, what is not yet redesigned enough to get the waste out and save money. So we've put a lot of effort in that to get that out of what's been traditionally a batch production modality to a flow production modality.
And you know, a few years back, I spent some time at the Disney Institute, and as I looked at the video of your new clinic, you're really kind of into this on-stage, off-stage kind of scenario that keeps the patient experience on stage, and yet there's all this stuff going on in the halls behind the scenes that really speeds up the flow and improves the experience.
Yeah. In the map there, the perimeter was the production environment, we call it. We actually call it a beehive. And it has our flow stations in it, where our flow manager actually gives the provider direction about what to do about indirect care as soon as he or she comes out of a room from direct care. And if I don't pay attention to that, I will start to batch it up and avoid doing it, stay by myself after work and do it, present her with a huge batch in the morning that gets in the way of her starting her work. And what Toyota basically found was that if you build fuel injectors in a huge batch when half of them haven't even been ordered, it will cost more than if you built them just when they were ordered. So as each little piece of information comes in, she assembles them in a prioritized little bundle. I do 2 or 3 of them in between each patient visit, and then and only then do I go in the exam room. If I take direction from her, our costs go down, our time with the patient is preserved. That's what we're mainly after.
Now, I've also seen you using some software that anticipates the patient visit and all the things that need to be done in a very proactive way.
Well, this is the mistake proofing part. Mistakes in medicine are different than mistakes in assembling a fuel injector. So you really can't get an appointment, you can't get roomed for a visit, and you can't have a visit without everyone checking what's called the health maintenance module, which knows by your age, your gender, and the conditions you do or don't have, what tests or interventions you might be due for, overdue for, or is the result, the last result we got, out of range and needs to be improved. And this makes prevention and disease management everybody's business. The telephone service representative you make an appointment with, the medical assistant who has a standard sequence she follows in the room. She actually uses some computing steps that makes that the first screen, the only screen I see when I turn the computer on, so I can't avoid it. And I go through and do what's called a successive check. So there's checking for quality at the source when you're doing your work, and a successive check by a colleague, built on a platform of mistake proofing, which is just software that has for the first time written up the rules about who needs what when.
So improved quality, improved patient safety, improved cost, but we're talking so much about the patient experience. What are patients saying about the way they're treated?
Most of them love it because they don't like waiting. So the record is that it's 6 seconds between when the patient rooms herself in a room, say Mountain 13, and the medical assistant walks in and starts their work together. On average, it's about 10 seconds through the first 2 to 3 hours of the morning. At the end of the half days, it kind of builds up a little bit because we add on extra patients.
So looking at that video, I noticed that the doctor and patient are sitting in front of the monitor, and as the doctor's working, the patient's actually observing and really engaged.
Well, the patient is the partner we haven't traditionally had in medical care and mistake proofing it. So we're sitting looking at the electronic medical record together. You and I would be sitting here and the monitor would be here. And you can correct me if I make an error, but mainly I can show you resources. We can search and show you diagrams. I can show you your fracture online. We can go through your health maintenance module together and prioritize.
Great work at Virginia Mason. Man, it makes me think I should go back into practice again.
Well, I'd like to show you more. Why don't you come on over?
Will do. Hey, Kim, thanks for joining us today on Health Tech Today.
You're welcome.
For more information about the guests or topics on Health Tech Today, just go to healthtechtoday.com. Health Tech Today is being brought to you by Microsoft.